management of pleurisy. It is due to the inflammation of the pleurisy in the human body. That is, there is two lungs. Each one is covered by the two layers of the membranes called as pleural membranes. When it is inflamed, it is termed as pleurisy or pleuritis. For management, we have first to discover the etiology of the pathology. If it is infected or infective, then antiviral treatment is only the symptomatic to relieve the distress of the patient. Almost no medicine is required, only the symptomatic treatment is done, and it is cured on its own after 1 or 2 weeks, provided the patient takes sufficient rest and nutritious diet, and also the symptomatic treatment for the cough and the pain. In bacterial, there is bacterial infection due to the streptococci and staphylococci. So for that, we have to do culture and sensitivity. Blood sample is sent to the laboratory to detect and prescribe the suitable antibiotics. Because bacterial pleurisy is only treated by the antibiotic medicines. Mostly there is penicillin type, amoxicillin, ampicillin, etc., and the azithromycin 500 milligram tablets BD dose for 2 weeks, and also injection or the shots are given, injection ceftriaxone 1 gram BD for 1 week to eradicate the infection or the pathogens causing the pleurisy. Now the symptomatic treatment is the patient should lie on the affected side, he will feel better. He should have plenty of fluid, and the diet should be very nutritious, rich in protein. Analgesic treatment is by acetaminophen, ibuprofen, and indomethacin. These are the very effective medicine to alleviate the pain of the patient, because the main hallmark is severe stabbing and tearing pain in pleurisy, whether it is dry or whether it is wet. Next, we go to the cough suppressant, because there is dry, non-productive cough in pleurisy. For that, codeine cough syrup or Piriton elixirs, they are usually prescribed by the healthcare providers. So these, in addition to this, these medical treatment, hot pad fermentation, they also bring some relief to the patient one. Next is the surgical treatment. Surgical treatment is because there is accumulation of fluid, whether it is hemorrhagic, whether it is due to pus formation, or there is air accumulation due to the injuries and hole formation from the lungs or from outside injury. So that causes compression of the underlying lungs. So the capacity of the lungs to ventilate is reduced, because there is extreme crucial pain on inspiration, and also the vital capacity is reduced due to the compression of the and the compression and the collapse of the lungs, because underlying lungs, due to the pressure of the fluid in the pleura, they undergo compression. Due to compression, they undergo collapse, whether it is partial, whether it is semi complete. But these are the is very dangerous one because ventilation process is suffered and oxygen supply is reduced. For immediate relief, we have to drain out the material, fluid whatsoever from the pleura outside the body. For that, we perform a minor surgery process which is called thoracentesis that under general anesthesia and may be performed under local anesthesia. I mean, the draining tube is passed through a pore or incision made in the chest wall approaching into the pleural cavity. So the drainage tube is inserted in the cavity of the pleural cavity, and other end is, I mean, it is connected with the sucker machine. So all the material is sucked out by this process. When it is hemorrhagic one, pussy one, thick one, then we also inject various chemical fibrinolytic chemicals to break down the clot to make it easy that all the material along with every sort of pathology must be drained out by this process. This is a process which bring immediate relief to the patient and also expand the lungs to their full capacity for proper ventilation of the body and oxygen exchange.